mitral valve disease, whenever the patient is symptomatic, for sure it should be fixed whether the valve is stenotic or regurgitant. And in young people with a grossly abnormal valve, it should be repaired even if they're asymptomatic.
It's usually picked up by the echocardiogram, like we were talking about, and there's certain criteria that we look for on the echocardiogram. For instance, if your valve is not that bad, typically you'll have follow-up echocardiograms either annually or every 6 months. And what you can see some changes if the heart starts to thicken, because what happens is the heart has to start beating a lot harder in order for it to pump the blood through the valve, or if the valve doesn't close the way it should, the blood just keeps going back and forth. So the heart has to work a lot harder. And whereas so you work your bicep out, it gets nice and thick. That's a good thing. But for your heart, that's not. Your heart, what happens is it gets stiff and the wall starts to thicken. And when you start to see changes like that, sometimes you're not even at the point of being symptomatic, but they can measure certain measurements of the valve and certain pressures that the heart has to produce to pump the blood. And a lot of times we'll recommend surgery. So.
And a good number to think about is if the valve area that has the effective size of the valve is a half square centimeter or less, the valve should be replaced immediately, regardless of whether symptoms are present.